Hi, I'm Dr. Bill Berkowitz of Life Chiropractic in Grass Valley. I want to talk to you about the 5 critical elements to a successful fibromyalgia treatment program. There is no clear cause to fibromyalgia, so the medical approach is not going to yield a solution or a resolution of it. All they have to offer is medication. And the medication all comes with limited impact and significant side effects. So the other thing to look at is that you could talk to 10 different people with fibromyalgia and get 10 varying stories of what they experience. So it's not clear. I have over 35 years of practice experience, and I've put a great deal of attention on solving fibromyalgia and other chronic pain problems. And here are the 5 critical elements that I've identified in addressing fibromyalgia. One is we need to address what I call sympathetic dominance. You have 2 critical parts of what we call the autonomic nervous system. There is the sympathetic nervous system, commonly referred to as the fight or flight system. When that gets overactive, it drives increased pain, increased inflammation, increased muscle tension, disturbed sleep, increased heart rate, increased blood pressure, impaired digestion, and the list goes on and on. You get the idea. We want to address that. We want to help calm the sympathetic system down. The other thing that we want to do is we want to increase what I say vagal tone. The counterpart of the sympathetic nervous system is the parasympathetic nervous system, which is predominantly the vagus nerve. Vagus nerve activity is associated with lowered blood pressure, lowered heart rate, rest, recovery, healing, quality sleep, relaxation, decreased inflammation, and the list goes on. So we want to decrease sympathetic dominance, increased vagal tone. And the third thing is we want to look at posture and movement. Quite often when you experience a chronic issue like fibromyalgia, you instinctively move in certain ways and adopt certain positions to try in an attempt to relieve the pain. The problem is that quite often those very movements perpetuate and increase the pain in the long term. So we want to look at simple things in terms of how you stand, how you sit, how you move, to try to identify those things that might be perpetuating the fibromyalgia and reduce that. The fourth one is we want to look at stress awareness. Now, I'm not a fan of stress management, but we do want to try to identify what are the things, what are the positions, what are the situations, what are the events that tend to escalate, aggravate, increase your fibromyalgia symptoms. And we want to try to modify those if we can. In all likelihood, it will be difficult to eliminate them, but we want to modify that. Because if we can't get a hold of what's driving the continued cycle of fibromyalgia, it's going to be difficult to get in control and unwind it and correct it. And the last of the 5 critical elements is sleep. Now, sleep is a double-edged sword, and here's what I mean by that. When you get under chronic stress, and that's one of the ingredients that causes fibromyalgia, it disturbs your sleep. The problem is that the disturbed sleep drives increased muscle tension and pain and increased inflammation. The increased muscle tension, pain, and inflammation drives disturbed sleep, and the cycle becomes a self-perpetuating cycle. So we want to address consistent sleep habits. And as we reduce the irritation to the sympathetic nervous system, as we increase the activity of the vagus nerve, it'll be easier and easier to get quality sleep. And the more quality sleep you get, you will experience a decrease in fibromyalgia symptoms, as well as a decrease in symptoms like anxiety and fatigue and a whole lot of other things. But you can't accomplish quality sleep with medication. If you're interested in scheduling an appointment, go to my website, lifewithinchiropractic.com, and there's a scheduling link there. Please subscribe to my social media channels where you'll get great information on a regular basis. Thank you for listening, and I look forward to meeting you.